Hello, welcome back. This episode is discuss how to think about Medicare before you choose anything. Many people think first about plans, choices, or who to talk to once they have good option in their mind, but those are not the first step. The first step is location. Where do I live? Do I stay local or do I travel? Do I receive care in more than one state? The second step is other benefits. Do I have provider preference? Do I have other coverage such as Medicaid or employer benefits or dental care, hearing or vision care? If these two steps are not clear, any decision will feel confusing. In the next episode, we will talk about decisions and what really matters when you are ready. There is no rush. This is for educational purposes only, and you always have the right to pause or to walk away. Today, we are looking only at private costs. Private costs exclude Medicare Part B premium because it is the same on both sides. The following premium examples use Nevada numbers for illustration. On the left, Medicare Advantage. Many plans have zero premium. Part A deductible, $1,736. Part B deductible, $283. The in-network annual out-of-pocket limit has a median around $5,900. There is also a federal maximum, $9,250. For Part D, there's a separate federal annual out-of-pocket cap, $2,100. So in general, the yearly private budget range is 0 to about 5,900. Yellow digits may be 0 if care is not used. This is a structure comparison, not a recommendation. Now, and let us imagine a healthy year. The same person. On the left, Medicare Advantage. If medical services are rarely used, many of the yellow digits may be 0. The yearly private budget can be 0 to 5,900. But in a healthy year, it may stay very low. On the right, Medigap with Part D. Using Nevada as an example, Plan G premium, $175 per month. That is $2,100 per year. Part D premium, about $420 per year. So even in a healthy year, the private cost starts around $2,520. Because of that structure, the seesaw may tilt to the left. Again, this depends on usage. Now, consider a year of heavy medical use. The same person. On the left, Medicare Advantage. The median in-network limit is about $5,900. There's also a federal maximum, $9,250. If care is extremely used, costs can move upward toward that range. On the right, Medigap with Part D. Again, using Nevada non-specific plans example numbers. Plan G premium, $2,100 per year. Part D premium, $420 per year. Part B deductible, $283. Part D annual out-of-pocket cap, $2,100 separate. In an illness year, the total private budget range may be around $2,520 to about $4,903. Because of that structure, The seesaw may tilt to the right, and this is not about better or worse. 1.6, it is about risk preference and budget tolerance. For 2026, the Centers for Medicare and Medicaid Services, CMS, has announced the following key figures for Original Medicare. The Part A inpatient hospital deductible rises to $1,136. The standard Part B monthly premium rises to $202.90. The Part B annual deductible increases to $283. These changes underscore why understanding the trade-offs in Medicare options matters more than ever. This episode is not about choosing a plan. It is about understanding the fundamental trade-offs between the two main ways to experience Medicare. Think of Medicare Advantage and Medigap as two sides of a seesaw. When one side goes down, the other goes up. The balance depends entirely on how much medical care a person actually uses. When someone rarely uses medical care, the Medicare Advantage side of the seesaw tends to stay light. Medigap, however, still requires monthly premiums even when little or no care is used. This is why people who seldom visit doctors or hospitals often feel the Medicare Advantage side is lighter and more comfortable. When medical care is used frequently, various out-of-pocket costs begin to add up on the Medicare Advantage side. This is where the Medigap side cost often feels lower and more stable. Medigap trades higher monthly premiums for greater predictability and fewer financial surprises when care is needed often. There is no right or wrong side of the seesaw, only different balance points that fit different health situations and patterns of care. Where the seesaw ultimately settles depends on personal circumstances and the answers to key questions like these. This is about how to think. Start with the right questions. Choices come later, when the picture is clear. In the next episode, these questions will naturally guide the next steps. Before you choose anything, many people think first about plans, choices, or who to talk to, but those are not the first questions. The first question is location. Where do I live? Do I stay local or do I travel? Do I receive care in more than one state? The second question is other benefits. Do I have other coverage, such as Medicaid or employer benefits? If these two questions are not clear, any decision will feel confusing. In the next episode, we will talk about decisions and what really matters when you are ready. There is no rush, and you always have the right to pause or to walk away. Start with the right questions. Choices come later, when the picture is clear. In the next episode, these questions will naturally guide the next steps.